Hello and welcome to the training for the CARE Act implementation. This training is specifically for volunteer supporters, and we're going to be talking about principles of supported decision-making and what that looks like in the CARE Act. And we're going to be looking specifically at your role as the volunteer supporter. So let's go to the next slide and review some of the topics that we're talking about today. So you see on here, we're going to have an introduction to supported decision-making and talk through what that is, highlight key concepts and principles, and then we're going to specifically look at what supported decision-making looks like in the CARE Act process. So outlining the responsibilities of the supporter to support decision-making, and then discussing a scenario that provides an example of how one may support that individual to make their own decisions under an SDM framework. So some learning objectives for you. By the end of this session, you should have an increased ability to explain what supported decision-making is and how it can be promoted for individuals eligible for CARE Act, and then also better understand how you as a supporter can help facilitate supported decision-making. So we're at the end of this training, you should better be able to do those things. So as we jump into the content, I want to highlight our speakers that we have today. So we have two individuals. We have Dari Pogash and Barry Jacobs, and I'm actually going to have them introduce themselves. So Dari, will you share your background about supported decision-making and why it's an important topic for you personally?
Yeah, thanks, Patricia. Hi, I'm Dari Pogash. I'm an attorney, and I spent several years of my career working for the District of Columbia's Protection and Advocacy Program for people with disabilities, where I represented individuals with mental illness and developmental disabilities, making sure that their wishes and preferences were being respected and acknowledged, in particular in receipt of federally funded services. And this was around the time that supported decision-making was gaining traction as a legal concept. And it took off because it represents a true paradigm shift from a substitute decision-making model that has, for most of history, has been the given for people with disabilities, that they are not able to make their own decisions and need either a court-appointed individual or a family member to make decisions for them. But I would say in the last 10 to 15 years, the concept of supported decision-making has really taken off, recognizing that we all have the right to make our own decisions and that people with disabilities should have the services and supports in place to make those decisions. So that legal background will really inform my presentation today. I've also spent a lot of time working on elder justice and disability rights issues in a wide array of topics, including adult guardianship or conservatorship, as it's called in California. And supported decision-making is a really important, frankly, a fundamental alternative to more restrictive forms of decision-making, the most restrictive being guardianship or conservatorship. So I'm sure my background will come up more during the presentation, but with that, I'll pass over to my colleague, Barry, to introduce himself.
Thank you so much, Dari, and really wonderful to be here with you today. So I'm a clinical psychologist in the state of Pennsylvania. I spent about 30 years working in both behavioral health and medical settings. I was a medical educator for 24 years as a faculty member in a family medicine residency program. And in my career, I've focused very heavily on assisting families, helping loved ones who have chronic and serious illnesses, including serious mental illness. So I've been something of an expert in family caregiving. I've written 2 books on the topic and write a column on the AARP website. And I've done a lot of clinical work with families who have children with schizophrenia in particular, who have struggled to know how best to care for them. So I'm happy to be here with you today, and I'll turn this back over to Dari.
So Dari, do you want to jump in the first section?
Sure.
The first section, again, an introduction to supported decision-making, talking about SDM as a framework generally, and then we'll look at how it's incorporated into CARE Act. So Dari, you want to start off with some high-level principles?
Yes, thanks, Patricia. You can move to the next slide, please. So this is a definition of supported decision making that I really think of as a fundamental level setting definition. Supported decision making is supports and services that help an adult with a disability make his or her own decisions by using friends, family members, professionals, and other people they trust to help understand the issues and choices and ask questions, to receive explanations in language they understand, and to communicate their own decisions to each other and to others. And so I invite you today during this presentation to think about what supports and services enable you to make your own decisions, and what supports and services would enable individuals, if you are a volunteer supporter or considering that role, what supports and services would enable the person that you're supporting to make his or her own decisions. Next slide. The CARE Act statute represents that supported decision-making is a fundamental tool to advancing self-determination. And I do want to read the language from the CARE Act just to really emphasize how central SDM, or supported decision-making, is to the CARE Act process. Self-determination and civil liberties are important California values that can be advanced and protected for individuals with these untreated severe mental illnesses, with the provision of legal counsel for care proceedings, agreements, and plans, as well as the promotion of supported decision-making. So here we see in the language of the statute that the goal of the CARE Act is to optimize the person's self-determination and autonomy to the greatest extent possible. And supported decision-making is a thread throughout that process that can be used to ensure that the person is always driving the process, making clear what it is that they want, and also getting the information that they need to make informed decisions. Next slide. So I also want to take a moment. I think it's important for volunteer supporters to be familiar with supported decision-making as one of several options that can serve to support people to make their own decisions. So it's quite possible that the care respondent is already using or interested in decision supports, and that could include supported decision-making. It could also be a medical or financial power of attorney, an authorized representative form, healthcare directive, including a psychiatric advance directive, a release of information form, and a representative payee. And this is important because supported decision-making can be a tool to enhance the autonomy and the self-determination of the individual while engaging with any of these decision-making supports. Next slide. So when we talk about supported decision-making, I want to emphasize that it's a framework, it's a model. And so it's going to be different for everyone because we all make decisions differently. We all have our own personal backgrounds, relationships, cultural background, racial and ethnic identities, and all of these factors are going to play in how we make a decision. I find it really helpful when I think about supported decision-making to start with myself and to think, okay, what decisions did I make today? Did I make every decision on my own? Did I ask someone else for input? Did I have a hard time deciding what to eat for breakfast? Did I ask my partner what he thought would be a good thing to eat for breakfast? Maybe I was making a bigger decision. Maybe I was debating going back to school to get a degree in education. So perhaps I called a former teacher or a family member to talk about the pros and cons of going back to school. What are the factors that influence my decision? I just referenced many personal, internal factors, identity-related factors, and of course, there's external factors too that can influence why you make a decision when you do. And then finally, I invite you to think about, did you get advice and did you take it? So for those of us whose decision-making authority and ability have not been questioned, we often take for granted that we can take someone's advice, we can think about the pros and cons of a decision, and then we could decide whether or not we want to take it. And these are the kinds of processes that go into the supported decision-making framework. Next slide. So I've been alluding to factors that influence decision-making because it's really so important. Supported decision-making, it doesn't occur in a vacuum. And we have to honor each individual's identity, their background, where they come from, and understanding how and why they make decisions and how and why they're going to relate to others when thinking about, when in a supported decision-making framework. So for example, if you think about culture, in some cultures, supported decision-making will be quite intuitive. The idea that you have a network, whether it's one or more people who you trust and respect and value their ability to communicate with you and to help you think through all the factors that go into making a decision. But in other cultures, that really may be quite a foreign concept. There are cultures where for a whole community, an elder or a group of elders makes major decisions on behalf of the whole community, or where it's expected that a family member plays a certain role in making really important decisions for everybody in that family, from a choice of who to marry, to where to live, to what job to take. And so it's really important that we respect people's backgrounds when talking about a supported decision-making framework. Family dynamics are so key when we're talking about decision-making. And I know my colleague Barry is going to talk about this more in his presentation, but what we're asking volunteer supporters to do in the CARE Act process, in some ways, if a volunteer supporter is a family member, and we expect that many of them will be, we're really asking them to shift from a relationship that's likely decades old, where all kinds of influence goes into making a decision. There are some decisions where perhaps we're more emphatic. This is really what you need to do. This is what has to happen. And supported decision-making means that the person, in this case, the care respondent, will be making their own decision. The role of the supporter is not what often happens in a family dynamic to try to convince the person of the decision to make. Instead, they're think through their options to make sure that the respondent is receiving information in a manner that is accessible to them, and then ultimately that they're able to articulate their wishes and preferences and make their own decision.
The question that comes up a lot is, are there limitations to using supported decision-making? Are there times when it's simply not going to work? So, I want to be clear that there's no black and white answer to this question. Supported decision-making is a decision-making framework and model, and it will play out differently for every individual situation. There are some general examples we can raise where it's likely that supported decision-making may not be appropriate in that instance. So what if a person is threatening to harm themselves or others? If a client or the respondent in the CARE Act is threatening to harm themselves or others, the supporter, first of all, should call emergency response. And it's very specifically says in the statute that the supporter's role does not include helping the person in that instance make a decision while they're threatening to harm themselves or others. What if the person doesn't want to engage in supported decision-making? So, supported decision-making can only work if the person is interested, eager, and willing to do it. What I would say in that example is, of course, we can always try to encourage the person to use it, to explain again what it would mean, to talk about why is the person doesn't want to use it in that instance. But it's ultimately, it has to be the person's decision whether or not to talk to others to seek support for a decision that they're making. And then finally, what happens if the person is not communicating their expressed wishes? So there may be circumstances where a person is not in a position to communicate. They may have a medical or a psychiatric limitation that is something that the crisis that's occurring and is limiting them from being able to actually express what they want. In these instances, supported decision-making may not be feasible, but under a supported decision-making framework, under the model and aligned with the guiding principles of supported decision-making, the supporter in that instance should really still be seeking, do we know the person's previously known wishes? Are there any other legal documentation that expresses their wishes, like a power of attorney or a psychiatric advance directive or a living will? And in those instances, of course, that documentation or those previously known wishes should be raised and hopefully respected and followed. So I just want to close on this slide by reminding everyone that someone may be experiencing a psychiatric crisis, but that doesn't mean that they are not willing and interested in working with a supported decision-making network to make a decision. So I want to say, just because someone's having a crisis doesn't mean that they cannot participate in supported decision-making. And these are some possible limits, but supported decision-making does apply if a person wants to make a medical decision that's contrary to their team's recommendation. They should still be able to make their own decisions around allocations of resources. For example, do I want to pay my rent or pay my cable bill this month? And then finally, social and relationship decisions. Supported decision-making is not limited by what some might judge the person's decisions, whether they're good or bad decisions. And I think that that's really important to remember. Next slide. And we have our first hypothetical. This is Sean. Sean has a diagnosis of diabetes and opioid use disorder, and he's currently unhoused. His doctor has recommended that he amputate his toe, which has gangrene, or he will lose his foot. Seems like a pretty clear, reasonable medical advice. You want to keep your foot. You don't want to, this is an immediate and urgent situation. But Sean has a worry. He's worried if he'll relapse if he's medicated for surgery. And he says, I'm going to forego the surgery. I've decided to forego it. So many of us who work with individuals with mental illness may have observed this kind of situation. I know that I have in my work as an attorney. Next slide. So the question is, well, what do we want? Under a supported decision-making framework, what's the ideal outcome? So I can't tell you what the ideal outcome is in terms of Sean's medical, the results of his medical decision. Under supported decision-making, the ideal outcome is that Sean made the decision himself, and he had the necessary services and supports to make a truly informed decision. And what this means for the volunteer supporter is if the supporter is available and Sean wants the supporter's engagement in making this decision and engaging in supported decision-making to determine whether or not to have surgery, these are some of the questions that I would advise and hope that the volunteer supporter could answer. So did Sean have all the information he needed to make an informed decision? If the care act respondent, the person is comfortable with having Sean at medical appointments, having the supporter at Sean's medical appointments, then the supporter can make sure, Sean, do you understand what the doctor's telling you? Would it be helpful if the doctor rephrased his or her advice in a different way? Did Sean have the option to talk to the surgeon about other options, about medication options for someone with opioid use disorder? So did they talk about alternatives that could make the decision easier for Sean? Did Sean's psychiatrist participate in the treatment plan? And finally, did Sean get to tell the doctor how he felt? And what I have seen in my experience with supported decision-making is often the most powerful part of this framework is that the person gets to express how he or she feels and what he or she wants when they have a long history of not being heard and respected. Next slide. So we're going to move on to our next section and look at how supported decision-making applies to the care proceedings. Consider how you would summarize supported decision-making as a framework and make a note of questions you have about the supporter's role. So whether you're considering becoming a volunteer supporter or having another role in the Care Act process, I really urge you during the next part of our presentation to think about, if you were in the supporter's role, what information would you need to understand how to work with the Care Act respondent under a supported decision-making framework? So we're going to talk about supported decision-making in the Care Act process for just a couple slides, and then I will be handing over to Barry, which I promise will be a terrific presentation. Next slide, please. So I want to start with
person-centered planning as a tool within supported decision-making in the CARE Act. The components of the CARE Act process are structured to ensure that the diverse and unique needs of each respondent are heard, recognized, and met. Person-centered planning means prioritizing the person's strengths, capabilities, preferences, lifestyle, and culture. So person-centered planning and supported decision-making have a lot of overlap. They often go hand in hand. And the way I see them interacting in the CARE Act process is the supported decision-making approach helps the different roles within the process in using person-centered planning to support the respondent and ensure that their priorities, choices, and decisions are heard. Next slide. So when does STM come up during the CARE Act process? There are parts of the process where it's going to be more useful and more relevant, starting with the voluntary engagement stage, because at this stage, the potential respondent, the CARE Act respondent, has some decisions to make about whether or not they choose to engage in behavioral health services. And so this is a great time for the respondent to have a supported decision-making network, to have someone like the supporter to make sure that they are getting all the information they need to make a decision. And I think part of that is understanding the CARE Act process, because part of the supported decision-making framework is really understanding the pros and cons and the consequences of a potential decision. So this is a great time to help the person understand what are the consequences or the outcomes of choosing to voluntarily engage or to not voluntarily engage and to move on in the care process. The next part of the CARE Act process where supported decision-making is really relevant is the care plan or agreement. Again, because there's a decision that the respondent can make here, whether or not to engage with the care agreement or to move on to a court-ordered process. And so it will really help the volunteer supporter to understand what the steps are in the process and to be able to talk those steps through with the individual. There's going to be another training coming up in a few weeks that will be available on psychiatric advanced directives. So supported decision-making comes in here. A psychiatric advanced directive provides the respondent with an opportunity to document their wishes in the event that they do not have the capacity to make a decision at a future time. But supported decision-making can be a really useful framework for the creation of the psychiatric advanced directive, which is all about thinking through scenarios and making decisions with all the really crucial information that someone needs to make a really informed decision. And then finally, the graduation plan. What will life look like in the future for the CARE Act respondent when they've completed the care process? And now I am going to move on to Barry. So next slide, please. And Barry, please take it away.
Dari, you have given me such a big warm up here that I feel almost embarrassed to take over now. But here we are. We're going to try to, just the way we talked a little bit about Sean as an example of supported decision making, we're going to apply supported decision making in the CARE Act process to another hypothetical individual who we will make up his name. We'll call him Ray. We'll say he's a middle-aged man who has a diagnosis of schizophrenia, as well as alcohol use disorder and type 2 diabetes. As many of you know, the atypical antipsychotics that many people with schizophrenia take, unfortunately, has a side effect of eventually giving them type 2 diabetes. Like many people with schizophrenia, unfortunately, he's not consistently involved in mental health care, and he's not currently involved in mental health care. And he also has inconsistently used the antipsychotic medicines that have been prescribed for him. So recently, he has had a number of emergency room visits, not for his symptoms of schizophrenia per se, but because of his symptoms of diabetes. One of the complications that have resulted from his diabetes is neuropathic foot pain. He has what's called sensory neuropathy. Is one of the somewhat common but really terrible complications of late-stage diabetes. So he's in pain. He's going to the ER to try to get some relief of his pain, and he's currently unhoused. So there is a homeless outreach worker who checks in with him regularly and thought he would be a pretty good candidate for the CARE Act proceedings. And as part of those proceedings, he's asked who he would like to be his volunteer supporter, and he chooses his older sister. Next slide, please. So where is Ray in the care process that Dari just laid out for us? So he's pretty far along at this point in our story. He is at the point of creating a care agreement. He was screened by a behavioral health agency that made some initial recommendations about him. And here are the recommendations. The agency is recommending that he have a complete medication evaluation and that he ought to follow his provider's recommendations. They also recommend that he pursue treatment for his substance use disorder, specifically for alcohol, and that he see a primary care provider for his medical conditions, most especially his diabetes. So next slide, please. So in this hypothetical, what we find is that Ray, like many of us, kind of picks and chooses what he prefers from a list of recommendations. So somewhat surprisingly, at least surprisingly to me, he decides that he would be willing to see a psychiatrist to be evaluated. But seeing a psychiatrist does not mean he's willing to commit to ongoing antipsychotic medication utilization. He also, at this point, is not interested in either having treatment for his substance use disorder or seeing a primary care provider about his diabetes. And maybe the thing that's most of interest to him in the CARE Act process is the possibility of getting some financial support and to get housing, to get off the street and into some sort of shelter. Next slide, please. So you hear that Ray has a kind of a host of issues. In the CARE Act proceeding, he's asked his older sister to help him. And as Dari described, the volunteer supporter's role here is really not to make choices for him, but to help him better understand the options that he has to make decisions related to his care agreement. So with Ray's consent, his sister will talk to the case manager at the behavioral health agency and any other providers there that are pertinent in this conversation to understand why the agency made the specific recommendations that they did. They will, and the sister will also, in her conversation with the case manager, make sure that that case manager is aware of what Ray's specific preferences and priorities are, that, as we just discussed, he's going to pick and choose among those recommendations. And then a lot of what the sister, as a volunteer supporter, is going to do is really just talk with Ray about the options before him, to help him, not to lead him in any direction to make a specific decision, but to help him understand those options so that he can make his own informed decisions about which treatment and services he would like to have included in his care agreement. And as we'll talk about at greater length in another presentation, the volunteers, the older sister may have been somebody who always was an advisor to Ray. That's not the role she's playing here now. She's playing almost as a facilitator of a conversation to help Ray make his best choice. And what we consider to be a best choice is up to Ray. It's not up to the older sister or the behavioral health agency or any other providers. Next slide, please. So a large part of what the older sister is going to do with Ray is basically to help him think through some of the consequences of making one choice versus another. I mean, what we want with anybody in making an informed choice is to basically be able to anticipate what the good and bad consequences might be from making a specific choice. And again, the volunteer supporter is not supposed to be lecturing the respondent about any potential consequences, but as simply asking questions, maybe rephrasing what the respondent is saying, so that the respondent can hear in the reflection back just what he's thinking about here, what he's thinking about choosing for himself, and what the consequences of that may be. So this role of helping a respondent anticipate consequences is extremely important to help that person make their best decision. Next slide, and I'm going to turn this back to my good friend, Dari.
So supported decision-making in the Care Act process can help ensure that Ray has the information he needs to make his own decisions. Ray can talk through the pros and cons of his decisions. Ray understands possible outcomes and consequences of his decisions. Ray's volunteer supporter and others in his supported decision-making network have been part of the process. Ray feels respected and heard, and Ray makes self-directed decisions to the greatest extent possible. I think some of these outcomes or these underlying principles will seem quite intuitive to many in the audience. And I do think a lot of what supported decision-making is about is really recognizing the underlying values of the CARE Act, that many of us share, the right of people to self-determination, to make their own decisions, which ultimately leads to greater sense of self-worth and self-value, and is so important. Next slide. So, and we're going to end with a question for all of you in the audience. Ray's sister has undergone training in supported decision-making and believes she understands how she is supposed to help Ray. But she sometimes finds herself subtly encouraging him to decide to take certain actions, such as taking his antipsychotic medications more regularly. So is she following the principles of supported decision-making? Barry, what do you think?
So what I think is Ray's sister is being a caring family member who is doing what would be normal and expectable for a family member who knows that Ray is going to function better in society if he takes his medicines. But in fact, even though she's being a good family member, she's not really following the principles of supported decision-making by leading him in one direction here. And I mean, her job as a volunteer supporter is simply to frame the questions for him, to anticipate the consequences, and help him make his decision, even if she doesn't agree with that decision. I imagine this will be very hard for Ray's older sister, as it would be for many family members in the volunteer supporter role when they don't agree with the respondent's decision. But that is what the law states, and that is it. So I would say she is unfortunately deviating from some of the principles of supported decision making.
Thanks, Barry. I appreciate that. And that was why earlier in my presentation, I was so glad that we have you to talk about family dynamics and how they play out with the volunteer supporter and the CARE Act respondent under a supported decision-making framework. I would say, and I said this in the beginning, again, supported decision-making doesn't happen in a vacuum. These personal relationships are so important. And we really are asking folks to shift from these old relationships, from dynamics that have existed for a long time, and to be quite intentional and deliberate in how they think about the CARE Act respondents' approach to decision-making. What I think is so powerful about supported decision-making is that it really does place the emphasis on the individual's right and autonomy and furtherance of their own self-determination. And ultimately, the more that we engage in supported decision-making, hopefully the more open Ray will be to discussing the pros and cons of a decision. In this case, the decision is whether or not to take his antipsychotic medications more regularly. It's quite possible that he has a history of feeling like no one really listens when he wants to talk about side effects of the medication, his fears of taking the medication, why doesn't he want to take it? And that's what supported decision-making is all about, is really making sure that Ray has all the information he needs to make that informed decision. So I want to thank Ray's sister and all volunteer supporters, past and future, who will be taking on this really challenging role and really pushing themselves to engage in this new kind of decision-making framework. At this point, I'm going to hand the microphone back to Patricia.
Thanks, Barry and Dari. And we'll go to the next slide just to recap some of our learning objectives today. The goal was for you as the participant to have an increased ability to explain why supported decision-making can be promoted for individuals going through the CARE Act process, and then understand how you as a supporter can help facilitate supported decision-making. There are additional resources for you, training on the volunteer supporter role, for maintaining neutrality in the supporter role, and other trainings on the CARE Act process. But on the next slide, we have our website and our email address if you have any additional questions or needs that you have. And then on the next slide, and you can find these linked in the PowerPoint file that accompanies this recording, are different resources on supported decision-making if you're interested in learning more and about how you can incorporate these principles into your role as a volunteer supporter. And please reach out if you have additional questions. Thank you so much.